Hello all, myself Dr. George Zakaria, working as specialist gastroenterologist at Universal Hospital Abu Dhabi, and today I would like to speak to you something regarding peptic ulcer disease. Now, peptic ulcer disease is one of the most common conditions which we encounter in gastroenterology, and ulcers in the stomach and the upper part of the small intestine associated with gastric acid are called the peptic ulcers. The most common causes of peptic ulcers include the drugs like painkiller medications, the aspirin, the steroid medications. Then we have the bacterial infection, which is very common nowadays, the Helicobacter pylori infection. Then we have the various habits which are associated, like the smoking, the alcohol ingestion, and also a variety of other systemic illnesses can also be associated with peptic ulcer disease. Patients with peptic ulcer disease very often present with upper abdominal pain, upper abdominal burning sensation, and sometimes with complications of peptic ulcer in the form of bleeding. And the patients with bleeding can present with vomiting of blood or with the passage of black tarry stools. Then in patients with obstruction due to peptic ulcer, the patients will present with vomiting after food intake, which is associated with upper abdominal pain. Now, rarely the gastric ulcers can turn into cancers, which can manifest later in life as well. Now, the diagnosis of peptic ulcer disease is often aided with the help of an upper GI endoscopy, which helps in the identification of ulcers, localization of the ulcers, and also allows to take biopsy from the ulcers to confirm whether it is a malignant ulcer, that is, whether there is the presence of any cancer in the ulcer or not. The treatment of the ulcers are with often medications. Most importantly, we have the drugs which reduce the acid production, like the proton pump inhibitors. Then we have the agents which coat the ulcer surface and prevent the ulcer from deepening, like the sucralfate. And also we have the acid neutralizing agents which help in healing the ulcers in the form of the antacids. Now, in those people who are detected to have H. pylori or Helicobacter pylori bacterial infection, those people will require a course of antibiotic therapy which effectively eradicates the peptic ulcer as well as the acid related to Helicobacter pylori. Now, avoidance of smoking, avoidance of alcohol are very important in patients with peptic ulcer disease. Now, certain food materials like spicy food materials as well as sour food materials are known to aggravate the symptoms of peptic ulcer disease. So, it's optimal or ideal to reduce the amount of spicy food materials or sour food materials which are likely to worsen these complaints. Generally, peptic ulcer carries a good prognosis, and vast majority of the peptic ulcers will heal over time, and the chances of cancer in a peptic ulcer is relatively rare, though gastric ulcers can rarely turn on to a cancer.